Oh, yikes.
The poor, and the disadvantaged from all walks of life. Here at Jewish Family Service Freedom More Multi-Purpose Center, we provide comprehensive and innovative services for seniors from the most independent to the frail and the homebound. We provide care management, counseling, activities, support groups for older adults. Freedom More is not simply about services, it's a supportive environment and a warm family-like setting that ensures each of our clients receives the best possible care. The entire Jewish Family Service family is delighted to be joined here today by U.S. Health and Human Services Secretary Katherine Sebelius. Secretary Sebelius, thank you for your strong leadership at HHS, efforts to combat fraud, waste, and abuse in our healthcare system, and of course all the efforts to bring us new healthcare reform. We're very pleased. Secretary Sebelius has joined us today at JFS to meet you, highlight how you can help protect yourselves from Medicare fraud, and answer your questions about federal healthcare reform. As Medicare recipients, your help is essential in the effort to reduce fraud and increase awareness. Medicare fraud isn't a victimless crime. It's a crime against older Americans. None of you or any of the thousands of seniors served by JFS should have to worry about rising healthcare costs. As Secretary Sebelius said at a forum in Miami last month, at a time when families across the country are tightening their belts, they can't afford to watch premiums soar even higher to cover fraudulent claims. Thank you for joining us here this afternoon for this important conversation. I take this opportunity to once again welcome Secretary Sebelius to our family, Jewish Family Service. We're honored to have you here today, and we look forward to your remarks.
Well, good afternoon, everybody. How are you?
Hi.
It's a beautiful day here in LA, and I'm really pleased to have a chance to spend a little time with you. I want to thank Paul for hosting this conversation. You're going to hear in a little bit from Joyce about her important work as a member of the Senior Medicare Patrol, and Supervisor Zev, it's great to see you again. We were together yesterday doing some events. LA is one of the 44 communities in the country who has gotten some money awarded to work on how to reduce smoking and how to reduce obesity. They've got some really creative programs that will be launched, and so I was able to be with the supervisor and talk about that. And then today, the Attorney General and I, as you just heard from Paul, hosted a anti-fraud summit to try and bring some awareness about the kinds of fraudulent activity that we're trying to make sure and prevent, and if it does go on, to prosecute, that steal money out of Medicare and Medicaid trust funds. I've been able in the last several months to be in various parts of the country at similar meetings with seniors in Maryland and Montana, Oregon, Michigan, New Hampshire, Illinois, and hear pretty much the same kind of things. That first of all, a lot of people want to know what exactly is in the Affordable Care Act and what wasn't in the Affordable Care Act, so get some clarification about how it's going to work and how it will affect. But also to talk a little bit about some of this fraudulent activity that we're seeing and what we're going to do about it. And let me just say that at the outset, I am not only the Secretary of Health and Human Services and the person who oversees the Center for Medicare and Medicaid, but I'm also the daughter of an 89-year-old father who is a Medicare beneficiary, and I have helped him sort through a variety of issues as a daughter in a family, so I'm aware of the importance of the program from a very personal point of view. Some of the facts about the new law that I still think are not terribly clear to a lot of folks is that the Affordable Care Act, signed into law by the President 5 months ago, maintains all of the guaranteed benefits of Medicare, whether you have Medicare traditional fee-for-service or whether you have Medicare Advantage. It also is a bill that over time will close the so-called donut hole. There are millions, we think about 8 million seniors who last year fell into the donut hole, got to the gap in their prescription drug coverage, so they didn't have any assistance from the drug plan they had to buy prescription drugs. And this year, those seniors will receive a $250 check, but starting next year, there'll be a 50% discount on the brand name drugs, and that discount will increase over time, and the donut hole will be closed. There are some new benefits that will begin as part of this program. One of the features that Congress and the President thought was very important is to begin to focus more on health and wellness, not wait till people get sick and provide benefits, but try to keep people well in the first place. So Medicare will, starting in January, include a yearly wellness visit. Right now there's a visit when you first enroll in the program, but that isn't a yearly update, and we think that will be very beneficial. There won't any longer be any co-pays with preventive care. So whether it's a mammography or a cancer screening, those will be provided free of charge to the Medicare beneficiaries. Again, a way to encourage people to seek out preventive care and make sure that they get things checked out in the first place, and make sure that no one has to forego a mammography or a cancer screening because they don't have the out-of-pocket payment. We announced yesterday when I was with the supervisor that Medicare now will begin to cover counseling associated with those beneficiaries who want to stop smoking. This is a great example to me of the kind of thing that just didn't make a lot of sense about the program in the past. We would pay for smoking cessation help, but only after someone got sick, only after they showed up with some kind of disease or presented with some kind of illness. Makes a lot more sense to me to actually help them not get sick in the first place. So starting again in January, if the 5 million Medicare beneficiaries who still smoke want some help to stop smoking, that will be covered as part of the preventive services, and we think can, again, save lives and save dollars in the long run, because we know smoking is one of the preventable situations that underlies a lot of chronic disease, underlies heart disease, some forms of cancer. So really helping folks before they show up with the disease may make good sense. The laws also are probably the toughest anti-fraud measures ever passed in the history of government. The President felt it was very important that we make it clear that we are not going to tolerate any longer criminals who steal from the trust fund, folks who set up phony systems and try to rob individuals. And it's everything from individuals who are trying to prey on vulnerable populations, who go after Medicare numbers and steal them and then proceed to bill, to very sophisticated criminal activity. I met with a Los Angeles doctor today, Ann Peters, who has been practicing since the mid-'80s here in Los Angeles. She's an internist and did the same kind of practice for years. What happened to her is someone stole her Medicare provider number, so they got her doctor number and began to bill for patients she never saw and services that she never delivered. She stumbled into it accidentally when a fellow doctor called and asked why she had ordered 10 MRIs on a patient. And she said, well, not only did I not order 10 MRIs, I've never ordered an MRI in the first place, and this is not my patient. And she began to unravel a situation, report the activity, call Medicare. We had investigators who helped track it down, only to find out that it was not only Dr. Peters, but eventually there were 19 doctors involved in this situation. They were not voluntarily involved, but someone had gotten their numbers and was billing for a whole host of activities. And when they finally tracked down the criminals, it was even a little more frightening, because these were not just bad guys, but they were bad guys who were armed with assault rifles and semi-automatic guns. They had a series of false documents. They had bulletproof vests. These were serious bad guys. And unfortunately, we're finding more and more sophisticated fraudulent activities. And so we need better tools. So the Attorney General and I were asked by the President to work together and set up some systems to try and prevent fraud in the first place. We're going to do a much better job screening providers before they can get into the Medicare system, before they can start sending bills, doing background checks and verifying, in fact, that someone who says their address is here in LA or in Miami is actually delivering a service, so having people go verify it. We're working closely with U.S. attorneys on the ground, with state attorney generals, with our investigative forces to, if we suspect activity